So this is actually a really great question. When you're on a birth control pill, you're getting synthetic estrogen and synthetic progestin, so you do not ovulate. That is the whole purpose of the birth control, not to ovulate and to prevent conception, right? So when you're on that, your body is not producing estradiol, which the egg produces as it grows, and after ovulation, it produces progesterone. You're getting a synthetic version of both of those. Most women have a problem with progesterone. They don't make as much progesterone as estrogen. So you cannot properly assess progesterone on the birth control pill because you're not ovulating. It would be like if I gave my kids money and they went to college and they really were trying to save because they weren't getting a lot of money, and all of a sudden they got a good job and they started spending and their habits were different. We can't tell what your ovary is doing when it's suppressed. You can check thyroid, you can check insulin, glucose, metabolic labs, you can check androgens even, and sex hormone binding globulin, which is going to be high on the birth control pill, but you can check that. Before I've done the Dutch test while you're on birth control pills for people like you that cannot come off, or some people just come off for 1 month for testing, and that's even helpful. But if we do, I've seen it both ways. I've seen it super suppressed still on the birth control pill because you're not getting your endogenous hormones that your body makes, or I've seen it high. So for such an expensive test with the Dutch test, I hate to waste it on somebody when they're on their birth control pill. I have also checked some hormones in the pill-free week for my patients who cannot come off the birth control pill. So I do know how to navigate this, and if you're a hormone specialist like I am, you will know how to handle